Let's move on to this story now, where the Gift of the Givers has donated 5 million rand to improve the state of the Groote Schuur Hospital in Observatory, Cape Town. The project is aimed at reducing the backlog of patients waiting for essential surgeries. The NGO is urging individuals and businesses to also extend their support. For more on this, we're joined by the founder, Dr Imtiaz Sooliman, to speak to us from the mother city. Doctor, no doubt that you've been engaging with various stakeholders over the past few days. There have been reports around the hospital being in dire need of essentials. And maybe just break it down for us in terms of how dire is the situation at the hospital?
Good evening, Rofhiwa. It's not a question of being dire at the hospital now. There is a backlog of patients. Because of COVID-19, many of the surgical theatres have to be closed. And of course, there's not enough staff. And when staff get sick during COVID, we have an additional crisis. So because of COVID itself, there's been a backlog of 6,000 surgical cases. And now with the waves gone down, the hospital management, the head of the surgical unit, Professor Lydia Kane-Cross, came up with an idea that we have to catch up at least 1,500 per year. That's the maximum we can do, depending on the funding, which is 15 million rand. And also, it's for 6,000, it's going to take 4 years, unless more theatres are open, more staff are brought in. The problem with that is patients become more debilitated. Many may die in the process. Many will not be economically active. There's anxiety, there's stress. Mothers don't know if the children will be fine. Children don't know if the parents will be fine. So the faster we move, the better it is. We cannot afford any more backlog because people are waiting for just too long. The good thing about this, it's indicative of a caring public service, healthcare workers, where the management, the staff, and everybody involved are prepared to give extra time, extra hours, with no extra payment to assist. But to add to that, the 15 million rand is required is to put in an additional, a fully fledged theatre team that will concentrate fully on catching up the 1,500 backlog surgeries, whilst the rest of the team carrying on with a normal caseload that they had pre-COVID. But whilst catching up on the normal caseload pre-COVID, they will also lend a hand to the dedicated team that's there to do the COVID cases only. So the 50 million rand is towards that. And if, of course, there's more money and more staff and more theatres can open, then we can catch up more than 1,500. But this is only one hospital. There's a similar issues going on in hospitals throughout South Africa. Already since we broke the story, several hospitals have called us and said they have similar issues and want to have a similar intervention.
And of course, it's not just the issue of the backlog, Doc. There are issues of resources as well. You've just commended that hospital staff are willing to work above and beyond to make sure that they are helping as many people as they can. But they also need the resources to ensure that they are able to carry out their duties to the best of their ability.
Yes, there's three aspects to this. You need personnel, you need the facility, which is the theatre in this case, and the wards when they come out of the theatre, where to put the patients. And thirdly, you need the consumables. So in this surgery, there's various types of procedures involved. You look at knee replacement and hip replacement, which is very, very expensive in terms of the implants. Then you look at hernia repair, you're doing at breast operations, you look at a range of other cataracts, and cancer type of surgery. So there's a range of conditions that require various types of surgery. Some take a few minutes, some take longer, and some take much longer. The cost factor varies from a small amount to a huge amount if there's implants taking place. And in that case, we average it off to 10,000 rand per patient for 1,500 operations, but it's not exactly like that. That's just averaging it out. The implants and the consumables are a lot of money. Fortunately, Groote Schuur from their resources are committing their consumables to these 1,500 cases, and the 15 million is only towards payment of staff. The consumables are coming from the normal stock. So here's an advantage or an opportunity for corporate companies or medical companies rather, who supply government hospitals, who get the contracts, who are making money from the public service, to come forward and contribute items in kind at no cost. So we could save 1,500 or help 1,500 people, as in this case. But of course, we're going to require it for many other hospitals in the country. And the other appeal we're making is there are all the doctors who've studied in Groote Schuur, who've come out of this hospital. You've gained your experience you're learning your knowledge from the patients who've come to that hospital. Right now, it is time for active citizenry, where the country gets together to help our country and our communities in need. You studied here, you've gone into private practice, you've gone overseas, you've moved out of the country. We need your pounds, euros, dollars, anything possible to help your fellow mankind, your fellow people who are vulnerable in Groote Schuur. And if the calls come from other hospitals, we expect other medical personnel and whoever is associated with those hospitals to please support. There's no profit here. It's about making a life better for men, women, and children who are going through great difficulty, a lot of pain and hardship because they are not functioning.
Doctor, you've made that call to various stakeholders in the private sector, but the role that government can play in this instance as well, you do say that it's not just the one hospital that's going through this difficulty. There are a number who've been in contact with your organization, crying with similar needs. So the role that government can play here, and really not just waiting for the private sector to come on board.
The government has a crucial role to play. But of course, the government has made an announcement that you've got no money. They're saying they gave instructions to all hospitals that you can't employ any more staff if the posts become vacant. They can't place the junior doctors. They can't place community service doctors. They're saying there will be no infrastructure upgrade. There will be no repairs. They don't have money for additional staffing. In some hospitals, there's no money for food. They're not renewing contracts of doctors. They're not renewing contracts of nurses. They've cut registrar posts. And this is a huge disaster because it means there'll be reduced academic teaching for those students who are going through the system. But my call is directly to the finance minister, Mr. Enoch Godongwane. Your tax collection, you raised 150 billion rand extra, which you did not expect. Of course, the tax collection is much lower than previous years. We understand that. But in terms of your budget, you raised 150 billion rand extra. To me, it's vital to take a substantial portion of that. But it's not substantial. It's not going to cost that much. But to take that money and put a few billion into healthcare, because health is the #1 priority for any country, that your citizens need to be in good shape. And, more than anything else, we should invest in health. The country was on lockdown. We're probably the only country in the world that shut the country down when we had no wave. And when we shut the country down and there was no wave, we lost so many jobs and there was a bloodbath. We owe it to our population to come to the help medically. Because when we did the lockdown, our rationale was that we are preparing the hospitals for when the wave comes. We didn't prepare the hospitals because where's the staff? There was a shortage of staff before the COVID came. Now there's even less staff. Many healthcare workers have died. You're not renewing contracts. You're cutting registrar posts. You're not putting additional doctors. So in which way are you benefiting health service? It is time to take serious account and to come in with additional personnel, to come in with consumables, to upgrade infrastructure and use part of that 150 billion specifically for that. Yes, I understand. 9 million people's taxes can't assist 60 million people. And that is why we as citizens, the corporates, business people, professionals, have to come in to assist. So collectively, government, corporates, the public, anybody, 50 rand, 5 rand, 500 rand, 1,000 rand, let's do it together to improve the lives of the people of our country. It could be our children, our mothers, our family. So we require this combined effort to bring about Ubuntu and helping the people of our country.
Yeah, absolutely, Dr. Imtiaz Sooliman, thank you very much for your time this evening. He's the founder of the Gift of the Giver, saying that the spirit of Ubuntu needs to shine through here, and we cannot rely solely on government. Whatever you have that you can contribute, do it, because it could be your child, it could be a sister, it could be a brother that is in desperate need of medical assistance, and they are not able to get that because the resources just aren't there.